I did see the email from Gil that this is all a ruse. He's actually auditioning for the role of the next 007.
Actually, because bow ties are cool, I really hope to be Doctor Who.
Yeah, I was just about to say Doctor Who would make perfect sense. They've just finished the last Doctor. Yes.
And as they say, as our dear friend John Nasser says, try time travel. When do we want it? It's irrelevant. So
exactly.
Right, so that's it. But I felt that Amir, CNS Summit is coming up very soon, and Ritesh and I are going to be there. And I really think that anybody who wants to learn anything about innovation, it's the place to be. And so I know that you're by design, you're sparingly on the agenda on the website. And I just I can't wait to get there to Boston on November 7th. I just wanted to know if you wouldn't share with us what secret surprises can I look forward to at Summit this year?
They wouldn't be secret. If Amir tells us now. He's
just sharing it with us and 800 of his close friends.
Okay.
Yeah, I was going to say, Gil, I'm happy to tell you, so I'll have to kill you afterwards, which I don't want to. So
thank goodness this is a virtual podcast.
So I'm afraid I can't tell you any of the secrets at all, because as Ritesh said, that wouldn't be the point. The only thing I would say, quite honestly, is I don't know, because the most wonderful surprises will be totally spontaneous, and they'll be sparked by people like Ritesh bumping into people and having a lot of fun talking to people. So that's the best part, which is what we'll really see. We may not even know for a couple of years, quite honestly, till something comes to fruition, right? So over the years that we've been doing this for 12 years now, is I'll hear literally 3 years later about some big launch. They go, by the way, Amir, this has happened multiple times, because we asked people when we had our 10th anniversary. People came up with all these things I never knew had happened because people had met at Summit, right? They don't. There's no kind of surveillance that tells me that this happened. But when we asked people, we found that people, by just being able to meet each other in the corridor and having a human conversation, and getting to know people, is really the trick. And I think the way we've tried to do it is, unlike some meetings where everyone's wearing a suit and they're trying to act like it's a bit defense, or they're just trying to sell something, we don't do. I mean, that's just not what we try and do at Summit. So Summit is just a group of humans trying to come together. I don't really care who you work for or what side of the table you sit at. It's an opportunity for us to look at other people and say, is this someone that I think I'll have fun with? Is this someone who really has some creative ideas? And can we get together and talk about it? So I think those are going to be the surprises. Is really that's the fun part. That I don't know what the unplanned surprises are. There are plenty of planned surprises, but I think the most fun is there really are. One of them includes Ritesh, but at least one of them. So yeah. So does that answer your question a little bit, Gil?
It does. And something I was just thinking of our community, because a lot of us are connected to the health, and all of us are connected to the health innovation community, whether it be in terms of technology or molecules or ideas or health information systems. The whole community Summit being really, I almost think is like the central nervous system of that community is about ways of collaborating around novel solutions that will improve people's lives. I actually indirectly met Michael, and through Michael met Brooks, as a way of, just helping make sure innovators can press forward and survive. I mean, Michael, is that your experience of our community? It's a giving, caring, like, how can I help you community?
Yeah, I think just the little that I know from you, Gil, I was just really struck and impressed by your background. And, not only are you a emerging super agent 007 or Doctor Who or however you say it, but you were a former Israeli medic and also a soldier, which you can't even begin to share with us because that's so top secret we can't even know here. But you've emerged, all this that when you came on the show, Clubhouse, what the heck was Clubhouse? It was a COVID occurrence. This thing out of nowhere provided an oasis for people to connect. And on that, when you were just, when I felt fortunate because who is this, even though I have a big name, Michael Mann, the producer of Miami Vice or whatever, but I'm not him. But you, on the show really just shared what you're doing and how you're doing it. And you really got us excited. And I think, who was it? One of the companies you were advising, the remote patient monitoring, was it Zach? Yeah, he was.
Zachary.
Yeah, he was on, and so it's just that experience was just indelible about who you are as a person, because people connect with people. They don't connect with companies. They don't connect with ideas, yes, but people to people. So that's why I was really excited by you and Amir and Ritesh, and then Brooks as well, being here today on Dream Big Healthcare. And what the heck is Dream Big Healthcare? It's really about bring a friend, BAF. And yes, when I shouted that out, people were like, well, I never heard of it. Well, of course you've never heard of it, because it's bring a friend. You got to get a friend. So with that being here, we are really, what Brooks loves to say about this is, what is that? If you had $100 million and no red tape, where would healthcare be? What would you do with it? Just kind of getting excited with innovation, hearing from you, Amir and Ritesh. And so I'm going to stop there. And that kind of just gives you a background, and we can talk about bow ties. I'm a yerba mate drinking guy. I know Amir loves, I think it was, what was your tea today, Amir?
Oh, and usually Earl Grey. Today happens to be a form of Mason Imperial blend, but yes, normally Earl Grey, yes. I think Ritesh is a Tetley's guy, right?
No. PG Tips all the way, my friend.
PG Tips. That's right.
We are not doing Tetley's. That's the working man's team.
Traditionally, the tea thing, I'm coffee, U.S. coffee all the way. But, I don't know. Michael, your question, I want to throw it over to Amir and Ritesh for a bit, that question about the $100 million, because Amir wears many hats. He's the founder and curator of CNS Summit. He's really the driving force of a movement called Decentralized Clinical Trials Research Alliance, DTRA.org, which has about 150 members, including the Food and Drug Administration, other associations. I mean, he inspires communities that come together and work well together. But he's also a chief science officer for a biotech company and advises many other companies. So the concept of what would I do with $100 million is something that Amir does deal with on the magnitude of that as an advisor to companies. I've been in private equity. I know you like my background, but actually I was in one of the largest private equity groups with billions of dollars, but it wasn't mine to dole out. There was a board and limited partners to make all the big decisions. And Ritesh actually creates systems that allow companies to realize the potential of helping people, and as a result, make hundreds of millions of dollars. So I'd love to hear from Amir and Ritesh right now.
So I'm going to completely ignore Michael's question about the money and answer in a completely different way, okay? So I want to go back to what we discussed very briefly for a minute, was this concept of having a community that collaborates, that helps each other, okay? And I'd love to hear sort of your feedback on it. But to have real talk, this has not always been the case in life sciences. So now digital health is relatively young, not that young, but it's relatively young. And I think it tends to be a lot of innovators who tend to want to kind of help each other for sure, as founders. But if you look at life science companies, they don't have a history of being collaborative. So before CNS Summit, I have another nonprofit that I lead that's actually having its 20th anniversary next year. And that one started literally in an elevator where I was in an academic meeting, and it just happened that you couldn't make this up. I mean, honestly, the story is so kind of bizarre. At the time, I was running every single phase 3 program in the world. There were 8 of them in a certain indication. Okay, all these companies were doing it, and I was running it for them. And I got in the elevator on the top floor of this hotel at an academic meeting, and every floor, the partners I was working with were coming in because we were going down to an academic session on this indication. And it occurred to me that none of them talked to each other. So my joke, this is 19 years ago, was that when 2 pharma people met at an academic meeting at that time, if they were talking, one was interviewing for a job. They were not talking for any other reason. Because the reason was they were so hyper secretive about what they did and felt everything was a secret, including protocols, which now people say, patients should have input. Frankly, it should be put on the internet for crowdsourcing. Those concepts were alien. Like people were, for whatever reason, they felt they were the smartest people, that their version of whatever it was must be better than everyone else's and they can do it better, right? Whereas the reality was when people changed jobs, it was just cut and pasted from where they were before. So when I was in that elevator, I literally stopped the elevator at the bottom and I blocked the exit and I said, guys, you're all, and they were all guys. I said, we're working on the same problems and yet none of you are talking to each other. And guess what? You're going to make mistakes because of that. And do you think patients will be happy to hear that we're wasting all that money because you chose not to collaborate? So I think nowadays collaboration is a very overused word. And thankfully, there is a lot more of it. Obviously, COVID has really driven much more of that across companies. But I just want to acknowledge that spirit of working together doesn't always exist. And I think I'm giving you a very long answer, Michael. But if you had $100 million, to me, is how do we get people in entities to understand that they're not just cogs in the big wheel, that they have some agency over being able to really push people to do the right thing. And whether it's healthcare and life sciences, we have the same silos, happening, the same problems. So I would say, for me, it's not, one program or one thing. Is how do we really sort of enable the wishes of pretty much everyone who works in this area? Nobody came to life sciences or healthcare because they wanted to make money. Well, apart from, maybe the private equity people, Gil, but I think even the private equity people would say they try and do the right thing, right? So I would say most people get up in the morning wanting to do the right thing. So the question is, how do we help everyone really as individuals to feel empowered to do all the collaboration that they need to do to fix all the problems we all know we have? I don't know, Ritesh and Gil, if you have any comments on that.
I'd like to hear from Ritesh because I think Ritesh is with you. By the way, I know Ritesh indirectly by way of CNS Summit. I just want to say that. Yeah, he's never been to CNS Summit, but what happened was through CNS Summit, I met a lot of people. And in that circle, like people like Hassan Kadim and Shwen Gui and Milland and all these people, I was part of that circle. And, the circles can get bigger if they're inclusive and open-minded. And all of a sudden, Ritesh falls into the circle. And so because it's a circle of people who are really excited about ideas and helping each other, boom, Ritesh is around the table. So indirectly, he hasn't been to Summit, but he has been to Summit. And Ritesh, I'd love to get your thoughts on that.
So, I actually disagree with both of you and all of you, actually, regarding pharma. So here's the reason why. I think pharma approaches innovation badly. Every innovation deal or opportunity I've worked with in pharma, the lawyers come in first to talk about the IP before they think about the idea. And that kills a lot of it, right? If you talk to the innovation people who are increasingly frustrated within these big pharma organizations, they mean well. Gil, you're absolutely right. They get up every morning, or Amir, I think you said it, they want to do good. They want to make a difference. The problem is the infrastructure that's around them isn't suited for that. Give you an example. There's a small pharma company in Indianapolis, tiny, you may have heard of it. They created a digital group for a digital therapeutic. They put it over in WeWork. They didn't even have it at corporate, right? They put it out there in WeWork. These guys did amazing things. They created a whole environment, foosball tables, the whole startup feeling. The parent, they did have a rich uncle who gave them unlimited money to go do something. They built it. Now there's a fight going on internally whether what that's been built should be standalone business or should be an add-on therapy to an existing drug. Now, you know what's going to happen, right? It's going to be added on as the existing drug beyond the pill service digital therapeutic thing, and then it'll die. So I think what we have is we have amazing individuals, and I'm looking forward to meeting a lot of those at CNS. I don't know if you've seen the Twitter fest that's been going on today, but it's been fantastic. So to to go back, and this is not the fault of anybody. I'm not blaming anybody. It's the culture that we have. And the reason CNS Summit and things that Amir and Gil do to make that difference, and the reason I joined Finn from Ogilvy, was because there are people and individuals who are passionate about doing this. And we need to do that as opposed to saying it's the company's responsibility, it's pharma's responsibility, or it's the health system responsibility. There are people that should be brought together to say, here's a great problem. Michael, thank you for your 100 million. We're now going to go cure this, or we're going to go fix this, right? And I think that's where the opportunity is. Pharma is not going to come along. I don't see... Gil, you and Amir have been in this business longer than I have. I've been in pharma for 10 years. 10 years ago, I tried to get rid of the fax machine in clinical trials. They're still bloody using it, right? So I failed miserably. Can you show me or tell me, not in the clinical setting, but in the patient setting where they've developed something that has added value to a patient's life, can you show me one that a pharma company has done that's been amazing, apart from the Dexcom?
So you mean on the digital side? Is that what you mean?
Yeah, because don't forget, my lens is digital. I have a very narrow lens. I talk about if it moves, digitize it.
Yeah, I'm going to take that on. First of all, the challenge is not agreement or disagreement. It all is true. It all is true. These experiences are each one is true. The challenge is and I've learned this in private equity. One of the big shockers I had being sort of like recruited into private equity, having been a CEO of a company, was I learned the singular focus, which really helps me today, which is the singular focus is on return on investment for the limited partners' dollars. And that's their purpose in life. And the challenges with the pharmaceutical industry is, I just said it, you said it, the pharmaceutical industry. The whole basis of the mindset is to develop molecules, demonstrate that those molecules are safe and effective, and then get the Food and Drug Administration to be in agreement. And then, oh, by the way, get payers to say, yes, we'll put this on formulary so that there's not 500 pre-authorizations and step-through models. And by the way, to make sure that the companies that buy the health insurance can afford the health insurance and don't switch around every 3 years in order to bring down the cost. We have an incredibly fragmented health ecosystem. So the challenge becomes nobody knows or owns anything except their little piece of the action. So the challenge isn't the pharmaceutical industry or even the lawyers who come in first to protect the IP. The challenge is they come in first to protect the IP because they know that they will be under attack by some other company that says, hey, your molecule is kind of like our molecule. We're going to sue you and stop you from coming in and infringing our patent. There is no sense of collaboration. And then I'm going to turn this back to Amir. The reason I'm so enchanted with Amir and CNS Summit is in a place of fragmentation, chaos, and conflict, CNS Summit is an oasis of collaboration. And I'm studying it, obviously Amir is a friend, and I'm a CNS loyalist. But I'm studying CNS as a living laboratory of what might be. And so when I go to CNS Summit, I'm not just learning, I am learning. I'm studying intensely because I actually believe that the solution might come from a forum like Summit, which CNS once stood in the bygone age of Central Nervous System Summit. It stands for today, Collaboration for Novel Solutions. I think we need collaboration for novel solutions. And I think, Ritesh, you're right. And I think Amir is right. I think Michael's right. Brooks wants to be Switzerland. He doesn't want to dive in and get his head cut off. But I want to hear from Amir. I think Amir's going to agree with me. So there.
Ritesh, I have two answers for you, okay? But before I give you those two answers, because you're having a go at lawyers, I'll give you a lawyer anecdote. It's not even a joke. So Gil has been very closely involved in DTRA, we said new nonprofit around decentralized clinical trials and research. And I'll tell you the lawyer story. So somehow we managed within less than 3 months to enroll 130 major entities. If you go on dtra.org, you will see very big names, right, of these 130 entities. And a certain big tech company was the last one of the big techs to come in within that 3 months. and they got their invoice for membership, and then the person representing them said, thank you to my executive director, said, thank you very much. Now, can I please have the agreement, because I have an army of lawyers to look at it. And my executive director wrote back and said, no, there is no agreement. We're a membership association. There is no services involved. There is no agreement. And I could tell that we'd blown his minds, because I don't think he'd ever done anything without lawyers. And this is big tech, not big pharma. And he wrote back and he said, are you telling me you've onboarded 130 entities like this, including some government agencies, without a single lawyer involved? And my executive director wrote back and said, that's how we did it in 3 months. So that's my lawyer anecdote for you. So maybe there's no lawyers in Summit. But in terms of your challenge about show me one thing digital the pharma's done, so the opposite is true. Show me a single digital intervention that will have the reimbursement and the value that's not a rounding error to a pharma company, especially a large one. That's the first thing, right? The second thing is, interestingly, today, not only have I spoken, so Gil mentioned 3 people that, obviously know you, Ritesh, and got Gil to meet you. The 3 you met, Gil, you didn't know this, but I talked to them all 3 today, right? Just happens. And that just shows you how close we are across companies, right? I don't work with them in the company, but it's just the 3 people you mentioned, I've talked to them today. I also talked to a whole panel of innovation people from pharma as we were doing a pre-call for one of our sessions at Summit. And it was around our innovation index, which is a third-party assessment of digital innovation in pharma. Okay, and what was interesting is the large pharmas tend to dominate that, which is kind of interesting. So although I don't chair that session, I provoked them by saying, well, this is interesting. Why do you think that people think of innovation being in biotech, not large pharmas? So why is it that this index is actually dominated by big pharma? And on the molecule side, that might not be the case. And what they were saying, which I found interesting, was, and these are pure talking from very large companies, what they said was basically the luxury. So one of the people was head of digital at AstraZeneca. She used to be at Roche Genentech. And she said, look, at Roche, I had the luxury that I could develop novel outcome measures, take 6 years doing it, wait for the regulators to approve it. We had that luxury, and we have the budget to do that in some of these big companies, not all of them. And yet, the biotechs, just that's not their speed that they have to move on, nor do they have the budget, the bandwidth, or the people probably. So what's interesting, actually, although I agree that large pharma's infrastructure, as Ritesh put it, isn't necessarily conducive to innovation. Interestingly, I think when it comes to certain innovations that are very costly and take time, it may be that that's where we can use the bandwidth and the richness of big pharma to do it, versus them being able to execute, like Ritesh was mentioning, in terms of some novel digital thing, even if they put it in WeWork, right?
I think Amir said something that at some point we should tease out, which is there is something about large enterprises that can be edgy, it can be innovative, like Apple. Would we all agree that Apple is an innovative company? Ritesh is agreeing. Okay. I mean, you have Amir the Apple 13 already, right?
Yeah, I mean, some people would argue it's not as innovative as it used to be, right? However, I think that culture that we can talk about and contrast that to pharma.
I have to say, I have to acknowledge, only having the iPhone 12 Pro, I have iPhone envy. What can I tell you? But I'll have to deal with that. I might have to run out to an Apple store quickly
before you get to Boston. Yeah, exactly.
Before
whose phones are you envying? My 3 blue ones, or something Ritesh has got?
Ritesh probably has the iPhone 14, my friends. He's at that
level. It's the 15 beta.
But I really have to say that I have a question to Michael's question. I kind of, in my heart, believe that the ultimate innovators of digital health will be not expected and surprise players. I want to give you an example, and I'd appreciate everybody's point of view. I think Microsoft is going to surprise us and be an innovator in digital health. I think this is going to be a surprising comment. Ready? Walmart will be a player in digital health. I actually also think that Apple with the iWatch 7 is making a very clear statement that it is just beginning the journey of what it's trying to learn and do in terms of wearables, meaningful wearables that have science. And I think the reason is scale, resources, and talent. And I think that because they have all of those, I think Apple will start to hire a lot of scientists. They'll start to appear at CNS Summit, scoop up talent, and start to apply that. So I'm going to take Michael's question, as I said, and just say, I think we're at the dawn of digital health, even though I've been playing in it for 26 years. I think we're just coming into age where the bigger players are saying, I'm going to take this seriously now. So I agree with all of you for that reason. I think pharma is not the address. I think Ritesh probably is the savior of big pharma and digital health, how to apply it. I really believe that. That's why I kind of watch him and learn from him. And Amir, I think the playground you're creating for diverse communities to come together safely and learn from each other, I think it's bigger than Summit itself. I don't think Summit was ever a meeting. I think it was the Davos of our sector.
Look, 10 years ago, I was in the clinical side of the pharma business and nobody wanted to innovate. When I moved over to the commercial side of the business, everybody was innovating. The words I used to always hear was, give me something innovative. I need to really change what we do, right? Over the last 3 years, I've seen clinical actually take the lead. The clinical side of the business in pharma is doing some amazingly, amazingly good work. In 2016, I sat in Boehringer Ingelheim in Germany and suggested to Chris Corsico there at the time that he should invest in Medable. Medable was just starting out. I'd just seen Michelle in Palo Alto in that hovel of an office she had on university downstairs. It was her and one assistant, and that was it. And I came out of that and listening to this young lady, I said, this is big. So the next day I was flying to Germany to do a presentation to the board of Boehringer Ingelheim around digital health and the trends of digitization. And one of the slides I put up was, there's a company called Medable, and I looked Chris directly in the eye. I said, Chris, you're going to meet this woman, and you guys should invest in this company. And they went and did a deal with Science 37 instead, right? A couple of years later. So, you know, the clinical guys have caught up and they're doing some incredible stuff. Use of AI for drug discovery. I mean, everybody's embracing that thing. So I think on the clinical side, let's be clear, pharma is actually doing some innovative things around drug discovery, around use of technology, around the way that they can use this infrastructure that's out there, blockchain, all of these things. It's the commercial side of the business, the actual, the guys who then get the products out in the door that are still relying on salespeople, even during the pandemic. Secondly, to Gil's point, I think of all the people I follow, and I follow Google and Microsoft and IBM and everybody, I do agree, do never count Microsoft out. Never bet against Microsoft. The red herring that Apple has thrown in the marketplace of this privacy fight they're having with Facebook is a red herring. All they're doing is seeding the market to let consumers know that if there was anybody you should trust over Apple or Facebook, you should trust Apple. We're doing all the right things. But they did it already. CareKit revolutionized digital. HealthKit revolutionized the way no-code access to patient records, right? All of a sudden, I didn't have to use Yahoo Pipes or Google to connect to different things. HealthKit gave me all of the infrastructure on the back end to connect anything I wanted to iOS with no code, right? Drag and drop, which is how Michelle built Medable. And now you've got some ResearchKit, CareKit, HealthKit. I think the next step is Apple will absolutely own the patient. So if you're wanting to do anything with patients, you're going to have to be on iOS. No question. I have been on a kick. Every year, as I said, I pick a thing. When I first joined, it was to get rid of the fax machine. It failed miserably. This year and next, I've been on this rural health kick. I want to bring healthcare to parts of America that currently have to drive 300 to 500 miles to get to a GP, not even a specialist. Even with telemedicine, it's really tough because they don't have access to Wi-Fi, right? So people like Walmart, Walgreens, CVS, they have a store. So why can't we take the pharmacist and turn them into a GP?
Do you think that the future of digital health is because the consumer is embracing it? It's a direct-to-consumer model?
No question. Here's what's happened. In the last 18 months, our muscle memory has changed. We now expect and accept digital interactions more than ever, right? I can't remember the last time I went to a liquor store. Drizzly is my best friend, right? I press a button, Stuff arrives and it's at the door, the ring rings, and the guy leaves. And I go out and pick a box up and bring it into the fridge, right? So our muscle memory and our behavior has been subliminally changed. And there are millions of companies out there that are looking at this $3 trillion industry and saying, you know what, I'll take a piece of it. So Fox Health is doing the supply chain piece because that's what, 200 billion? You know, I'm a startup. I'll be happy with the 100 million of the 200 billion. I'm okay with that, right?
Then you can pay Michael back the
There you
100
go.
million he
Yeah,
lent us.
no interest either. Straight.
Yeah.
As long as there was no red tape, though, right?
There you go. There you go. So I think, you know, I'm looking forward to CNS Summit because, again, it's my first one. But I met Amir in person last year when my kid went to San Diego State. We had a lovely walk on the beach. And I was fascinated at what he's built and the history behind it and how he put it together. And I agree with you, Gil. I think it's an enormous opportunity for collaboration at this summit. And these collaborators are like-minded folks, as I've found on Twitter, that can do some incredible things together if we put them together. I think it's a fantastic thing.
That's great. So I've taken a few things from what Ritesh said. The first one is if you're a client and Ritesh gives you advice, you better bloody take it. Otherwise, he's going to out you in person by name, which is very refreshing. You will never find anyone in pharma ever naming anything, not even saying it's Indianapolis, let alone naming the company, right? So,
It's in his employment agreement, Amir. Actually, he wrote that into the employment agreement. I say what I want to say whenever I want to say it.
so I think that's the first thing I took away, which is great. So be careful. If you're going to get some advice from Ritesh, you better act on it. That's the first thing. I think the word you use, which I think we all agree is very important, what you discussed in terms of Apple's trust kind of for it. Now, I agree there's lots of context for that, especially against Facebook, but, you know, right here on my desk, here's my Apple Health thing, right? And because of the latest OS, you might not see it as a lie, but there's my vaccination in my wallet, right? Which the latest OS update allowed me to put on my iPhone directly from my chart, from my ear chart, right? With just scanning a QR code. But I think if a lot of people say that people don't care about privacy, you know, especially young people, etc., but maybe healthcare is one area that people do care about it. And I think Apple certainly is probably the one of, if you're going to have to choose between the big tech companies, it's definitely not going to be Facebook. It's going to be Apple for sure. So that's for sure. I would completely agree with that. Yeah, absolutely.
If you have a teen in your age, you have an iPhone. 84% of teenagers in the world have an iPhone.
Is that true globally? Really? That's an interesting.
Maybe India might be the exception because of supply chain issues there.
So what age am I if I have 4 iPhones and 3 non-iPhones?
12.
Oh, you're the
12.
millennial for sure, right?
You get
Exactly.
younger with each iPhone. You know, Brooks told me, by the way, before this program that he had an interesting statistic. He shared an interesting statistic on iPhones. He told me that about 72% of all statistics are made up on the spot.
That's what I was wondering.
And and I don't know where he sources the iPhone thing, but he's probably correct.
Guys, look, I do a radio show every Sunday. I have anywhere from 2,000 to 3,000 people. I look at the stats at the back end afterwards. 70% of them listen on the iOS device, whether it's a phone or an iPad.
There's your source. There's your source, Brooks. You got it cold now. You have a source.
Well, technology is not distributed equally, right? And the audiences that we're talking about have access to iOS devices, and of those, a high amount of them do. And it's almost like a hand-me-down factor. Really brings these younger people into that fold, but they also care and understand about privacy. And Apple's, maybe they're not the best about privacy, but they're at least the loudest about it.
You know, if you look at them, everyone is sort of bad. They're the better of the bad, right? If you think of it that way, right? But I do agree with you. Look, we're looking at what's happening in the next 18 months, but we're not looking at what's going to happen in the next 10 years when this generation that we have. And it's not only healthcare, it's just everything. The workplace, content creators. Look at the generation of TikTokers that are coming into the workplace in the next 5 years. Their expectation of how to do things is going to be completely different. I have fought email-centric cultures in corporations for as long as I've been working. When I joined Ogilvy 7 years ago, the first thing I did was deploy this thing called Yammer. And then Microsoft bought it and ruined it, right? But you've got to be able to cater to the youngster who wants to do this. And these guys are completely digital. Completely digital. I got an email from my son. I got a text message from the 18-year-old in San Diego, Amir, 2 weeks ago saying, "Dad, I have to write a check. What is it?"
And did he ask? Did he also ask you how to spell it with a QUE?
He didn't. Yeah. Because his world is Venmo and Zelle. He has no clue, right? So if we are to do these things and provide tools, wellness platforms, technology platforms for healthcare, the generation in the next 2 to 3 years that's coming up will devour it. They will take it, they will change it, they will hack it, they will, do all the things you want with it to make it better themselves.
So, Ritesh, I think that what you've just talked about directly is why biopharma, life science sector, has to become digital health savvy. You've just said it. There's a generation that expects to sort of the GI and older boomer generation has some expectation that they're going to sit in a waiting room for an hour to be seen for 10 minutes. But I think that your son's generation, which will enter into the medical system in the next few years, just in terms of preventive care, will have a totally different sense of consumer expectation. And if the payer, the provider, and the product inventor doesn't get on with the program, they're going to find themselves sort of like not irrelevant, heaven forbid, but really under the magnifying glass of critique.
So, Gil, I'm going to make everyone feel way better about the healthcare system. If you think the healthcare system is screwed up, welcome to life sciences. What I mean by that is, at least in healthcare, there's a pretense that you will get a survey for your satisfaction of how bad it was, right? In clinical trials, there is no survey to a clinical trial participant saying, did we do a good job, right? And so what I've been talking about science which is directly what Ritesh is talking about. What we've been talking about science for years. When I first started Summit, it was really interesting. We had a whole day initially, it wasn't integrated into the whole thing, on technology. And people were very kind of, why are we talking about, this is before the iPhone, this is before Google Maps. We sometimes forget how recent these things are, relatively speaking, right? And I don't think people even understood why we talk about this kind of technology. They really didn't understand the relevance. And I kept saying, okay, if our future patients are going to come to clinical trials, if their personal tech is way beyond what we're doing within our professional tech, right? What they experience in a clinical trial, they're just not going to volunteer for a clinical trial. So what Ritesh is saying in terms of employers have to be kind of looking at employees, well, guess what? These young patients who are going to be, coming to clinical trials now, they have no interest in dealing with the clunky old stuff that we have in clinical trials. So the same problem Ritesh is talking about, whether in employment or healthcare, is even more acute. Our patient recruitment rates are terrible enough as it is, right? Lots of ways to try and solve that, including decentralized and all that. But the fact that our technology is even worse than healthcare, right, is kind of stunning.
I think that says it, perfectly. We have so many challenges. And I think that we talk about collaboration, and that can be a very general, broad term. But I think of another word that is aligned to that, which is connectivity. I don't think the life science industry really sees the patient, the consumer, as a customer. I think they see the system as the customer. And they talk about the patient being at the table. But I almost feel like for many it's real and heartfelt. For many it's just jargon. Like we need to say the patient should be at the table. And what our friend Craig Lipset often says is we're not inviting the patient to the table. It's their table. Our whole ecosystem industry exists because people have health urgencies. If they didn't have unmet needs, people with unmet needs, we wouldn't have a reason to exist at all. And I think that digital health, what you and Ritesh have been talking about, Michael and Brooks, is the essential because it's the super glue that keeps this very fragmented puzzle from just going off into outer space, into orbit.
Do you guys see that we're going to have this inside out effect of healthcare? It's going to erode where we're going to have the providers and the patients, that the people, right, connected, and the system that's in the middle is going to kind of get out of the way. And if it doesn't get out of the way, it's going to be kind of forced. We have this decoupling of data and services, right?
It started already. I've got a number of friends who I never would have imagined would take control of their diabetes with things like the Aura Ring and the Dexcom and the January app. I sat with a mate of mine yesterday, and he's doing so well because the data that he's collecting and using to change his behavior has helped with his diabetes. He's lost 55 pounds. He's doing amazingly well. And that's based on one thing, the ring. He bought an Aura Ring a year ago. And he now religiously manages his diet, his exercise, and the way he does things. So I think it's already starting in pockets. The question here will be, how do you scale this? My fear, and it's a really, real fear, is that while this is all good, and as I said, I'm a digital guy. My lens is very digital. My motto is, if it moves, digitize it. But my fear is, as we hurtle through that we're creating a two-tier system of the haves and the have-nots. The haves who can access these things and pay for these things, and those big population bases who cannot, which is why I'm focused on this rural health initiative that I've been working on with my friend T. Faircloth, is how do we make sure that this disparity that we're in the danger of creating doesn't get created, that we use the technology to actually make a difference, just like it's been making a difference in the wealthy friends that I have today.
Well, Ritesh, it's worse than a tiered system is, and I don't misuse the word bipolar being a psychiatrist and neurologist, but we have a bipolar system. What I mean by that is more mathematical, which is it's not two tiers, it's two extremes, right? So right now we have in the US, we have the best care in the world and the worst care in the world, right? Not much in the middle. So what I would say is the same. So what I would say is, if that's already the case, right? So going forward, I don't see, unless we use digital, in appropriate ways, Aura rings are quite expensive. All the things you said are and they tend to be used by people in general who are more healthy anyway. So I think you bring up a really important point, and I think that's the promise of digital. Two ways. Yeah. One is scalability. The other one is most chronic conditions, and this is sometimes not appreciated. The reason a lot of digital work has been done in neuroscience is because actually behavioral change will have an impact on other conditions like diabetes, basically any chronic condition. So I think that's why digital is so powerful, because it can change behavior. That can change many things that one might not think of as behavioral, but diabetes will be a very good example of that.